Hello, everybody, and welcome to the badEM podcast. My name is Daniel Still, and I am your host. badEM stands for Brave African Discussions in Emergency Medicine, and this is a platform we use to try and find African solutions for African problems. This episode, we are featuring some of the team from the African Journal of Emergency Medicine, commonly known as AfJEM, which is the official journal of the African Federation of Emergency Medicine, or AFEM for short. We tap into the extraordinary minds of some of the people that have been doing wonderful work for emergency medicine on the continent for a very long time, as they dive into how research can move healthcare forward in an impactful and equitable way, and most importantly, with the African context at the forefront. With the different guests, we go through some of the history of the journal, the target readership and impact, their personal research journeys, and the importance of equity when it comes to research. We start with Professor Peter Hodkinson, the Editor-in-Chief of the African Journal of Emergency Medicine, followed by Paa Forson, Deputy Editor of AfJEM, who is driving change in West Africa, specifically Ghanaian emergency medicine. Then we get a nursing perspective from Professor Petra Brysiewicz, a co-founder as well as the most cited author in the journal's history. And then we chat to the illustrious Ken Diango, an emergency physician from the Democratic Republic of the Congo, who is also an associate editor. And finally, we speak to the CEO of AFEM, Dr. Lauren Lai King. An action-packed episode indeed, with each guest having the capacity to do a whole episode by themselves, which may happen in the future. But I do hope that you enjoy their individual perspectives and stories about the journal and growth of research on our wonderful continent. Without further ado, first up we have Professor Peter Hodkinson, Editor-in-Chief of AfJEM. Would you start off by giving us a brief breakdown of the history of the journal and how it got to where it is today?
Yeah, thanks, Stan. The African Journal of Emergency Medicine is the official journal of the Society, the African Federation of Emergency Medicine, and it started in 2012, so that's now 13 years. And has grown from what was initially a self-published little journal. The founding editors were Stephen Brains and Lee Wallace, and they started off with desperately trawling the continent and I think primarily getting South African papers with a lot of international authorship to start with. And about 5 years down the line, with a lot of hard work from the two of them, got the journal indexed with all the big international indexing things, that's PubMed, Scopus, and started an impact factor. And it was passed on to me in 2023 as editor-in-chief.
And what are some of the things that the journal has accomplished along the way, touching on the growth across the different regions in the continent?
Yeah, well, it's the only emergency medicine journal on the African continent serving just Africa. And we're the only indexed journal in this space at the moment. There are a lot of competing journals, not all with same indexing status. So we have, from a South African perspective, we have the Higher Education Department tick box that we're accredited with them and elsewhere. And we're now published by Elsevier, which is a big international publishing house, publishes The Lancet and The Lancet Global Health and a lot of other big name journals. We have the benefit of their editorial system and their publishing and marketing support, and that links us into Scopus, which is also the Elsevier product. So yeah, we're on the up, we think. COVID, the journal took a bit of a double-sided knock. We had an initial increase in publications directly related to COVID, and then actually a bit of a dip. And we're only just recovering from that COVID dip, which is what journals around the world have experienced, but perhaps we would have liked a more rapid recovery. So at the moment, we're in a phase of desperately seeking submissions. We published pre-COVID, we were publishing up to about 70 articles a year, and that's been down to about 40 and coming up. Last year, we published somewhere near 50. And it's looking much better for this year. We're halfway through and we're already past 35 publications, I think. So it's looking good. And our growth has come along with the growth of the speciality around the continent. And it's quite interesting to track that. We see an initially very heavy South African bias, but as we grow, we've seen as emergency medicine programs grow around the continent and emergency care from a bigger perspective, including pre-hospital nursing and the other corridors, has also grown. So at the moment, we're seeing a lot of East African submissions. Tanzania has a huge emergency medicine program. Rwanda, Uganda, they're all starting to move, as well as smaller subsets of publications from around the continent. We obviously chase geographic diversity, so we see an article from somewhere that we hasn't published before, where we actively support them to get published. Ethiopia at the moment is on the up. There's a lot coming from there. And we've tried hard to get articles from Francophone Africa. We actually have a few Francophone editors, and we've been trying to encourage the French articles. We have a system to get them in, although they've been quite slow. That's been quite difficult. So yeah.
And who's your target reader? And you mentioned that Elsevier supports you in terms of dissemination and their advertising channels and things like that. Who is the person that is supposed to be reading the journal?
Yeah, that's an interesting question, and I think that's kind of the cutting edge of journals and publication at the moment. I think if you'd asked that 10 years ago, everybody, 10, maybe 20 years ago, definitely, people saw a journal as a paper thing that came in your post box and that you read every month. And we're right out of that era. I think there's not many journals still using that product. It's probably those just purely supported by societies. So our readership is very much online. We only publish online. We publish 4 issues, sort of compartmentalize them into issues every year. But actually, I suspect the majority of our readership reads them individually as a download or a PDF. They would get a table of contents and pick things that are interested. Or we have a social media editor who shares those out over the various social media channels, and people would grab onto the link from there. I think that's the way publishing is going around the world. It's probably not so much a matter of a whole issue, but just getting the evidence out there with a stamp that it's been properly peer-reviewed and accepted by a journal is all that authors need to get it out there and disseminate themselves as well. So yeah, Elsevier gives us that platform. And they also have quite a slick platform which helps us with the review process. So all our publications are double-blind reviewed by at least 2 reviewers and driven by a team. I've just recruited a whole lot of new associate editors around the continent. So we're actually sitting with a team of about 25 associate editors with a big geographical scope representing regions and countries around the continent, as well as kind of niche topics. We've got people who are interested in qualitative research, pre-hospital research, and more system stuff. And we've got quite a broad coverage across the team.
And since you mentioned the diversity of your team and the different special interests, touch a bit on your pre-hospital section that you're hoping to develop. I know it's something that my guests in the previous episode from EXA were very keen on, in terms of using it as an outlet to grow pre-hospital research.
Yeah, so the development of pre-hospital care has dragged a bit across the continent, but it's growing. It's growing around the continent, and we're trying to bring this in as one of our focus areas. And in the next year, you'll see a pre-hospital section in the journal driven by pre-hospital editors from around the continent. I think it's quite exciting. It's quite a niche market that research is just emerging there. And the other reason is there isn't really another platform for pre-hospital African research at the moment. There was a pre-hospital journal launched in South Africa, but it has dissolved or is at least paused at the moment. So For pre-hospital research, you're looking to Australia. They've got an international journal of paramedicine, which doesn't quite speak to the African audience, or you're looking to the more general journals. So yeah, we're hoping to capture that pre-hospital market.
If you were a young author, what benefit would AfJEM offer as a platform to publish in?
For our authors, I think we offer an easy platform that's easy access to publish in. For African authors, it's free to publish in the African Journal of Emergency Medicine, which doesn't seem to be widely understood and disseminated, whereas you'd be paying a huge fee for other journals. We offer a relatively rapid turnaround from submission to publication, as well as African reviewers who have the context and insights to Africa that they bring into their review.
And then just finally, what do you think is the direction that the journal wants to go in? And you mentioned the pre-hospital section and things like that you're working on in the next year. Is there anything else that you're doing that's moving the journal forward?
I think at the moment our focus is just on growth. We really need to grow our number of submissions and acceptances. And we've got various angles that we're approaching that. We're trying to attract authors across the continent. We're driving that hard at conferences. For example, at the AfJEM conference in Gaborone last year, we published all the abstracts, and we've been following up and pushing quite hard at those presenters at last year's AfJEM, and a good deal of them have come forward and submitted to the journal. Many of them are first-time authors, so they need a good deal of support. And AfJEM is certainly offering that over and above what some of the bigger established journals are doing, who would reject some of the submissions that we are happy to input on. Sometimes it gets quite hard work. We're on version 8, revision 8 on some submissions, and still supporting it because we can see a publication in there and we can see the value, although the writing is hard work. Yeah, and we've had some webinars getting published. We're planning another webinar quite soon on becoming a reviewer, because there is a shortage of skilled reviewers around the continent. I don't think the shortage is in skills. It's probably more in confidence and understanding what we want from a reviewer. We've got a couple of special issues out. Education and triage are the current ones. And yeah, a new editorial board is I'm hoping, through associate editors in country, going to be also chasing submissions.
Thanks very much for the interview. Now over to the rest of your team to offer some valuable insights.
Great, thank you.
Next up, we have Paa Forson, who's the deputy editor of the journal and has a long personal history with the journal, which he will elaborate on. Welcome to the podcast, Paa. Would you mind starting off by just introducing yourself and giving us a summary of your journey with AfJEM so far?
Sure. Thank you very much, Dan. And thank you for the opportunity. And also, thank you for the great work you're doing for emergency medicine, highlighting the great work that is going on by clinicians across the continent, and the important work. And I'm thankful to God for this opportunity to have this conversation. So I'm Paa Forson. I'm an emergency physician trained in Ghana. I was part of the first early cohorts, I think the third cohorts of emergency physicians trained in the Ghana program. Been involved in emergency care over more than a decade now, working in research, working also clinically, both tertiary and rural hospitals in Ghana. And also recently I've been involved since COVID with working at the level of government. My first encounter with African Journal of Emergency Medicine was through AFEM, African Federation of Emergency Medicine, which is a solid and wonderful body that brings together emergency care practitioners across Africa. And indeed has also built a very good linkage with other partners in the other continents. And this is probably 15 years or thereabout ago, when I started to work in the ED. I had the opportunity of joining some conferences organized by AFEM. I believe that was one that was organized in Accra. And that was my first encounter with the Journal of Emergency Medicine. I believe what AfJEM did for us was to provide a platform for young, budding and emerging researchers to have an opportunity to express ourselves. And that journey grew from writing a few articles, going through the process of getting published, which is exciting because it is both bitter and sweet. And then, but you learn very good lessons. And then through that, I got the opportunity to reviewing what other colleagues, sometimes more experienced writers, have put together. It was a humbling process because for every review, there was an opportunity to learn something new, either the methods or somebody's style of writing and all that. So this is really what built me up, because I did this for quite a number of years. And my interest really peaked, and I still stayed doing review work till Stefan gave me the opportunity to go a lot more, and grateful to have Peter, who was happy to draw me in as deputy editor. But it's been a learning process. Even at this level, I'm excited with the opportunity to be learning, growing, and doing a lot more to add to scientific knowledge in the continent.
Thank you for sharing. Good things do take time, and what you've accomplished over the years is very inspiring to see. Would you mind by giving us an example of a paper that you authored or perhaps reviewed, in order to give our listeners just an idea of what type of things the journal values, or perhaps to inspire someone to start their own publishing journey?
Sure. I'll probably start with what some may, and for me, I'm saying this for the emergency care practitioner out there who feels that research or writing is so difficult and so impossible. It's quite a good experience. And so one of the papers I would share will not be a full original article, but I remember the opportunity to put in some very useful clinical pearls. This was in the GC pearls, and I think we still do that in the AfJEM. Basically, these are clinical pearls and ways we are able to, some of these practices in Africa, sometimes in Africa, we may not have all the equipment and all the setup that you need, but we still are able to provide some high quality emergency care. And sometimes we improvise with guidance. And you will find that in the AfJEM, we had such good platform to sort of share this knowledge. And for me, that is the beginning of being able to be a good author. What is around you? What are the things that we want every day? And so one of the examples I'll share is one pearl we wrote about how to, string method, or using a normal cord or like a suture to help you to take out a stuck ring on the finger. And so this was one of the pearls that we put together. Pretty simple, but was really well highlighted. And I was quite excited when we were able to publish this pearl. I reviewed quite a number of articles too. I remember one very good article that was done that for me, I was quite a learning opportunity, because this was around injury prevention. And that's one of the things of interest to me. And sharing, and this was an article that I didn't author, but I reviewed, sort of provided and highlighted very clearly what the injury burden was, and how, of course, there are very, very simple preventive mechanisms that could be put in place by the populace to avoid such, what are more like domestic injuries, household-based injuries, and sometimes leads to very horrifying morbidity and mortality. And this was published, and I thought was quite a good experience, learning about injuries and how injury patterns are studied in other countries. And, but these are the two out highlights. So just to say that it could go from something very simple around you that you do every day, describing it in a scientific way, to something that may be a bit more technical, but also highlights something that is of good social importance and also, of course, scientific importance.
Thank you. Yeah, I think that's perfect. Firstly, it's funny you mentioned that ring removal technique with the string. I used it just 2 days ago, and I was showing some students how to do it. So it's funny that you mentioned that. Well, the two papers that you've mentioned highlight the diversity and the adaptability one needs to be an emergency clinician in Africa. because we do deal with simple things like rings stuck on fingers on a daily basis, but then on the same day, half an hour later, we're dealing with a domestic violence incident which has roots in hugely complex socio-economic and historical aspects, which just shows how good research and how adaptable context-specific research is for our job.
Yeah, that's true.
To finish off, how do you personally see the journal, and what do you envision for the journal's future?
Thank you, Dan. I think that really going forward for me, I believe that in Africa, this Africa Journal of Emergency Medicine is for us. And we have a very good mouthpiece. Emergency care, structured or standardized emergency care may not be too many decades old in Africa, but we have grown. And this shout out to all these excellent practitioners who work at various fields in our continent, some in disaster medicine and others, policy, pre-hospital, great work. But what really I'm envisioning is that this journal becomes that mouthpiece that really highlights excellent work that is being done. We want to, I believe that the globe is yearning to hear a lot more about what we are doing in Africa, how we are able, with the resources that we have, bring about improvements in our health systems, improvements in the lives, reducing morbidity and mortality, which really is one core function of the emergency care practitioner. But I'm also looking at the diversity in us growing to really embrace and encompass the continuum of emergency care. And for me, I think it starts from pre-hospital all the way to end hospital. I believe that we have critical care as part of our ambit, and we also even looking at beyond or out of hospital care and really ensuring that we are able to highlight that continuum and also share success stories across the continent. This is really what I envision. But we are also that voice that says that this is what the standard should be. This is what the evidence is. And we need to do and strive more to ensure that we're providing that quality care. And I also wanted this opportunity to really say and encourage all emergency care practitioners across Africa. This is your mouthpiece. Look at AfJEM first. Before you look at others, we provide that template for you to express yourself scientifically. And you have with us a family that has a desire to strive for excellence. And we want you to bring your articles. We want you to reach out on how you may be able to publish your ideas. We're happy to support and provide this guidance. Thank you.
Thank you for joining me. And thanks also for all the work that you have done. And thanks in advance for all the work that I'm sure you're still going to do to help healthcare workers and patients across the continent.
Thank you very much for having me there.
Next, we have Professor Petra Brysiewicz, who needs no introduction to most in the emergency medicine and particularly the emergency nursing fields. Together with a colleague, she is also the most cited author in AfJEM history, largely due to a paper that helped others in their approach to how to do qualitative research, and then another about data analysis when it comes to qualitative research, both of which have been used worldwide to help aspiring authors on their own research journeys. Thank you for joining us, Petra. And would you also start by introducing yourself and giving us a brief summary of all the different hats you wear at the moment?
Sure, thanks very much. So I am a full professor of nursing at the University of KwaZulu-Natal, Durban, South Africa. I'm an honorary full professor at the University of Cape Town in emergency medicine. I'm a founding member of AFEM as well as a founding member of AfJEM, and have been involved with both organizations, obviously, for a very long time, since the beginning. I'm the editor-in-chief of the International Emergency Nursing Journal, and do a lot of things all over the world in terms of emergency care and emergency nursing specifically. I've been around 28 years involved in the education and developing research in predominantly nurses in the acute care setting.
And as you were one of the founding members of AfJEM and AFEM itself, Tell us a bit about the motivation behind that and the gap that you and your colleagues were trying to fill.
Thanks. So when we developed AFEM, we always had conversations around the fact that publishing research, especially emergency care research from Africa, was always very difficult, because we would try and publish in international journals, and many times they would say, we were dealing with this issue 20 years ago. It's not really important for us now. Or they would say, your context is quite different. And so, we can't really find how to fit your articles in. We also knew that we had a very, very large pool of enthusiastic but very novice researchers who often would send their article to these international journals. And even if the science was good and perhaps the research focus was interesting, usually they would fall down because it wasn't written in a publishable format, because our researchers, had very few role models as well to help them develop their research skills. So we knew that in developing AfJEM, we would create a platform for our researchers from Africa, and also to help promote, obviously, emergency care research across Africa, but also to provide a way to start to capacitate our young researchers. And so right in the beginning, we had an opportunity to do that through our Author Assist program. And I can't remember how many years that ran for, but for a number of us, we would, articles from perhaps more junior researchers would be flagged as being very relevant, very appropriate, but really needed some help with writing. And so more sort of senior experienced researchers would then help to work with the authors to get their articles to a publishable state, in which case then they would resubmit it and it would go through the process, would be then published. In the beginning, there was a large number of people who were going for that service. And sometimes, we were a bit overwhelmed with the number that we needed to support. But it's been wonderful to see how then, perhaps over the past 3 or 4 years, there was no need for such a service. There were very few requests. And in fact, I think it really speaks to the fact that our body of researchers in Africa have really matured and are doing well on their own. They don't need that kind of support anymore. Through my role as the editor-in-chief of the International Emergency Nursing Journal, one of the things I really wanted to do was to make sure that journal was international. And I'm just finishing my term now after 10 years. And it's wonderful to see now how many African authors are also submitting to international journals across the world. And I'm saying in nursing, but as well as the other emergency care professions. So I think through AFEM, through AfJEM, we've done a lot to support, the growth of research, and culminating in being able to have a special issue of emergency nursing research, which was just a recent issue. And again, wonderful to see that we're getting to the point where we can have special issues that are just around emergency nursing, which is a very new profession and speciality area, being able to have its own issue.
Wonderful. Thank you. It's wonderful to see something develop from something that needs a lot of work and support to a self-sustaining, self-fulfilling prophecy that expands on its own potential and becomes its own living organism that does its own job and is sustainable for future researchers and generations. So that's good that you highlighted that.
And if I may, I'm currently working with colleagues in Saudi Arabia who are starting their own nursing journal. And they are using a lot of the lessons that we've learned from AfJEM, and in fact discussing with me how they can start their own author assist, because they have exactly the same problems. So in addition to what you're saying, it's been wonderful to be able to share that sort of knowledge and experience with other colleagues around the world who are then embarking on the same journey.
Thank you for adding that. And then would you mind touching more on research in nursing in general, as with both hats on from a international nursing journal perspective as well as AfJEM? How do we promote more research to be done in the nursing profession? From anecdotal experience, there's probably evidence to support this, but most career nurses don't gravitate towards research and academia outside of academic institutions and outside of university faculties. How do we expose research as an option, as a career advancing medium, and as a health and outcomes, better patient care, better all of that promoting initiative? How do we promote that within nursing circles?
Thanks. So a very complex problem, and I would say it's not isolated to nursing.
Yeah.
I think you can go and talk to all the healthcare professionals, and they'll all tell you the same thing. So from my perspective, I think it starts with our training. Oftentimes, as we are training our health professionals and training our nurses specifically, when they are taught research, they are taught research in such a way that everybody seems to hate it and no one understands it. They're taught these very big words. They taught about all these complicated things, but it's not made practical and usable and relevant to your clinical practice. So I think it starts there. The next thing is when you move into the clinical area, there is no, okay, I'm talking very broadly now. There are very unique circumstances where this is not true, but generally speaking, organizations do not value research. So there's no time, there's no recognition for people that do research other than if they're doing it for formal degree purposes. So, for example, for many years, I was trying to be adopted by a hospital, and I was just offering my services so that I could work with teams to help get some research started. There's lots of work around academic clinical partnerships and how that can be helpful, but it's quite challenging. So I've been working with a group in a clinical hospital, and it's very difficult because research is always the last thing. So you always have to do all the other things first, look after the patients as you should, but there's always something else happening. And then when you have a bit of extra time, you can do your research. And so it makes it very hard. You have to be very driven and you have to keep pushing. I think the third thing is that you have to make the bedside clinical nurses and other health professionals see the value of the research. So I have a student in Namibia who's actually doing a study around surgical wound sepsis and working with nurses in surgical wounds and showing them the value of using the clinical data that they collect every single day in order to help them think about their patients and how to improve various things in their ward that they could be doing that then would improve the outcomes, of the patients. So I think we don't make it visible enough, so people don't necessarily see the value of the research. And then I think the problem is that if you do your research, how to disseminate it. So everybody focuses on publishing peer-reviewed journals, and if you're a nurse at the bedside who's just done a small study, that's probably not going to happen. But highlighting other ways of disseminating, making opportunities for such dissemination through maybe their hospital having days where people can present and stuff. In a lot of places, I think they're starting to do that, but it's very slow. And then it's also about encouraging collaboration. Doctors, nurses, other healthcare providers should be working together. That's personally why I love emergency care, because I think that's the one place in the whole kind of healthcare system where I think we all work really well together. And I think it's amazing because you really get to see the value that each brings. But unfortunately, in a lot of areas, that's not the case. So a very complex problem with just a few thoughts from my side.
Thank you for touching on that. I think it's a common problem between not only academia and research, but also public health and policy in terms of visibility, integration, and cause and effect of decision makings and why we do things, and like a sort of more closed loop feedback circle in what goes on a daily basis in a hospital. Before we finish, could you briefly touch on some of your research interests at the moment?
My own research, a lot of it currently is around sort of engaging with families, because I believe in resource constrained environments, we underplay the contribution that families do make and potentially could be making as we go forward. And that sort of really stemmed from my original work. My PhD was around managing sudden death in emergency departments. And it was through that work that I really started to stumble across the importance of working with families and the complexities involved. And through a colleague and friend, got introduced to the International Family Nursing Association. And that's really an organization that's focused on how we engage with families, how we involve families, and how they are part of the unit of care. And that then has guided a whole spectrum of my research. And so for people that are starting out, it's perhaps useful to say, you take it slowly and just keep working in a particular focus area. I think oftentimes researchers jump all over the place, and then your research body becomes quite fragmented. But it's often very, very useful and valuable. You keep working in a particular direction, and I've definitely seen how valuable and rewarding it is to be able to then look back on the 28 years and see what that has become.
I think we could probably talk for hours on that. Maybe that'll need another episode. But thank you for joining us for that short snippet, and thank you for all the work that you're doing.
Thank you. Thanks for the opportunity.
Up next, we have Ken Diango, an emergency physician from the Democratic Republic of Congo and an associate editor of AfJEM. Would you mind introducing yourself and include some of the areas of interest that you have in terms of research?
Yes. My name is Ken Diango. I'm Congolese emergency physician by training. I trained at the University of Lubumbashi. That's where I got my medical degree. And then I pursued my academic journey at the University of Cape Town, where I did my specialist training. And I then recently completed my doctoral studies in the emergency division of the faculty at the University of Cape Town. So my area of interest is development or strengthening of emergency care system in low-income countries, particularly in the DRC. So that's my area of expertise. And I worked on the adaptation of a community first aid responder program, which is basically a layperson responder system to increase out-of-hospital capacity in Kinshasa, in the DRC. So that's my area of expertise, is basically to strengthen emergency care system, mostly out-of-hospital system, starting with the response at the scene, because it has been established that there's no resilient pre-hospital system in most low-income countries. So my area of research is basically the systems to strengthen pre-hospital, or broadly saying out-of-hospital capacity in low-income countries.
A big undertaking indeed. Could you chat briefly about one of the papers that you published in AfJEM as an author that speaks to out-of-hospital system strengthening in the DRC?
Yes, one of the papers I published with AfJEM was a pilot, a World Health Organization community first aid training that we conducted in the DRC. So we conducted a mixed study analysis
of the training and several factors that pertain to the implementation of that training in the specific context of DRC. And it has been one of the papers that has been widely downloaded and cited in the last 2-3 years. So this was an implementation of a lay responder system, which is the WHO CIFA course that we adapted for the DRC. And we then conducted that course for 3 days. The methodology was a mixed method, as I say. So we conducted focus group discussion, but we also had quantitative data. And basically that paper revealed that such a system was feasible in the DRC context and was widely accepted, and with positive comment both from the participants, who are then the lay community members that were trained, but also the organizers, so including the people who participated in the adaptation and teaching of the course, and health authorities who contributed to the implementation on that specific health district. So that's one of the papers we've published after a series of other papers pertaining to first aid in community in low-income countries. Yeah.
Thank you. It's a very practical, implementable thing. And I think with research that backs it up, it shows that it can be broadened across to many regions and many other countries in similar situations.
Exactly, yes.
How important is AfJEM in terms of reaching an African-specific audience from the perspective of context-orientated emergency medical research?
First and foremost, it's about emergency medicine. And as you know, emergency medicine is not limited to some geographical region, but the particularity of AfJEM is that research conducted in emergency medicine on the African continent is specific, is really targeting the low-income country, broadly saying, but particularly Africa. As you know, emergency medicine is at a different stage of development on the African continent. I mean, it's quite recent, I would say 10, 15 years. Most countries don't even have residency and no research at all about emergency medicine, while in high-income countries, they've been publishing research on emergency medicine from their context for 50, 40 years. Mm-hmm. That's why publications made in Ethiopia, in Nigeria, in South Africa are really relevant for the resilience and the strengthening of health of emergency care system in regions like Senegal, like the DRC. And that has been the particularity of AfJEM, is to try and adapt, a specific context research to try and strengthen emergency care system in similar countries. And that's what AfJEM only can do, because when you look at other big journals, the Emergency Medicine Journal in the United States, or the BMC or the BMJ, all those journals do publish emergency care research, but it's mostly not adaptable, to the specific context of low-income countries. So that's why AfJEM is, over the last 10, 15 years, has been really the platform, the best suited platform for strengthening research and publish findings of research conducted in those low-income countries.
Thank you. And I think it's also very important for people on the continent who might not even necessarily be considering doing research themselves, but to be exposed to research from people that are in a similar situation to them, so that they feel reassured and supported by good quality contextual research, as well as people from high income countries get a much better perspective of what is actually happening on the continent.
Exactly, and that's how the network for strengthening of emergency care in Africa has been strengthened. It's not only by those who practice in this setting, but certainly there's been a strong support and strong participation of high-income countries researchers, and that is because the research that has been published through AfJEM has been available, for the readership outside the continent to have access to it, more so that it's open access. That's a particularity also of AfJEM. And the fact that, it has also in place a system to support, African author. A lot of publication in AfJEM are from first authors, so which is a particularity as well of the African journalists, to try and nurture those new researchers who are struggling to get published, to have the opportunity to be supported and to have a review system that is really adapted to their level, instead of having papers just from the first desk reception to be rejected. Here, the first authors, have the opportunity to be coached, to be trained in how to publish, and that's the particularity of AfJEM, and more importantly, getting them the opportunity to publish without the hefty fees that sometimes journals in the high-income countries will put, which will be prohibitory for most African authors.
Yeah. And then lastly, would you mind touching on AfJEM's Francophone side of things? As somebody who practices in the Congo and is from the Congo, would you mind touching on Francophone submissions and the regions of Africa, the French-speaking regions of Africa, and the research happening in them?
Yes, that's an interesting challenge for us. Africa has a lot of linguistic group. I would say English is one of the most spoken languages, but French is as well one of the biggest. I will put Portuguese and Arabic, but English and French are the most spoken languages on the continent. And it so happened that most of the literature that is being published on the continent, not only in AfJEM and elsewhere, are mostly from English-speaking countries. While the Francophone world in Africa, seems to be less published. So the undertaking from the AfJEM was then to try to give an opportunities and coaching and all the support system through the network that are currently existing to French-speaking authors. And it's we are lucky, some of us being at the same time French, Francophone and English speakers based on our training, to then be those who will be trying to coordinate all those efforts. Because it's quite important that Africa is not seen only from the side of English-speaking countries, which has mostly been the case in conferences and then in many forums. It's important then the research being conducted in Senegal, in Ivory Coast, in Gabon, in all those other countries be also available to the wider readership on the continent. So what AfJEM has then done is to try and get the Francophone author to publish in French. Initially, we were just having some abstract of English paper translated into French, but that wasn't enough. The next step has then been to try and get African authors who only speak French to publish in French. And then the system has been established between the editorial board to have editors who can then process those papers right from the beginning to the end in English. And that has been going. We've had 4 submissions, 2 have been published and few are on the way. But the key thing is to get the people to know that it's doable. And that's one of the undertaking we're having at the moment, to try and get not only the author, but the readership as well, to know that they can get a high-level research publication through the African Journal of Emergency Medicine.
Yeah, no, it's a very worthwhile undertaking. Is there anything else that you would like to touch on while you're here with regards to the journal or with regards to any other topics?
Yes, what I want to say that publishing and being a reviewer and editor in AfJEM has been really, at the personal level, an important factor in what I've become as an emergency medicine expert on the continent. So the process that AfJEM put in place to get a paper published, reviewed and published, and the feedback we receive from high-level reviewers does contribute a lot to to building, our academic acumen and our research pedigree. And it has been really an interesting journey for me to be able, not only as an author, but as a reviewer, and after that as an editor, to be exposed to this publication experience. And each level, I've interacted with first-time authors who have been just so proud of themselves just to get published the first time, and some have been published only once, and that has been really a tremendous experience. And having some, other authors, becoming reviewers after their 2-3 publication and coaching them into the review process has been also a quite enriching experience. And that's what AfJEM has been all about. It's about showcasing the capacity, the academic abilities of African researchers is really a tremendous achievement and an ongoing effort on AfJEM that needs really to be congratulated for.
Yeah, and I think the individuals like yourself also need to be congratulated for the long, windy journey that it takes to become a clinician, researcher, and manager in the African setting. So congratulations and thank you.
Well, thank you then. Yeah, thanks.
Next, we have Dr. Lauren Lai King, who is the CEO of AFEM. Would you mind by introducing yourself? And while we've spoken a lot about AFEM by virtue of speaking about the journal, would you mind by touching on the federation itself and what it is and what it stands for?
Yep, of course. My name is Lauren Lai King. I'm an emergency medicine physician by training. I had a little bit of a transition in my career focus in that I moved away from the day-to-day clinical aspects and more towards a global emergency care focus. So AFEM is a regional professional organization that represents the interests of emergency care providers across the African region. We know that there is a large proportion of the burden of disease that sits within the global south, particularly within the African region. We know that there is an opportunity to influence the outcomes from a health perspective by addressing emergency care within Africa. And so AFEM is really focused in on that. And it strives towards a mission and a vision that allows for access to high quality emergency care for all within the African region.
Thank you. And how does research and the journal fit into that goal?
So as an organization, AFEM conducts its activities through a series of different pillars that helps us to achieve our mission, our vision, and our strategic and operational goal. One of the key strategic and operational pillars within AFEM is to promote research and the research agenda within Africa. And it was identified very early on within AFEM that one of the ways within which this research agenda could be achieved was by establishing our own journal. There are a number of factors that contributed to that decision, and we may get into that later in the discussion, but essentially it was felt that in order for AFEM to be able to authentically and comprehensively address this particular strategic objective, we needed to have our own journal within which to promote, disseminate, encourage, and facilitate emergency care research in Africa.
It's been a recurrent talking point of the podcast, but would you mind commenting on the underrepresentation of Africa in the research world and what this lack of contextual clinical evidence means for emergency medicine practice in our setting?
I suppose you can call it hot off the press, essentially, is that AfJEM recently published an editorial in the current issue that is available. And that editorial essentially challenged a fundamental assumption in global health, which is that best practice from the global north or from high-income countries automatically represents the gold standard everywhere else. And essentially what the editorial posit is that best practice really is more of a nuanced balance between quality, equity, relevance, and cost effectiveness within specific health systems. And so similarly, if you think about it from an academic publishing perspective, equity in academic publishing is more than just access to journals. It also means having platforms where questions and local and regional contexts and solutions shape the global conversation. And essentially then the editorial shows how African research can influence global guidelines when we are asking the right questions for our context. And so this is something that was really positive for us in, we hope, moving the needle and contributing positively to the discussion, because AfJEM creates the space for research that addresses African priorities, not just African applications of research from the global north. And I suppose in a nutshell, that really captures what the purpose of AfJEM as a publication platform offers, and why, from the AFEM perspective, we feel that AfJEM is such an important product and resource and priority for anyone that is interested in African emergency care in Africa.
To continue on the theme of equity, what's your view on Africans doing research about and for Africa, as opposed to foreign researchers doing research for Africa, in inverted commas, where there might not be as much sustainable benefit?
Yeah, I appreciate the question. I think it's pretty complex, and I suppose as much time as you have is as much time as we can unpack this. But I think this is a discussion that's really timely, but equally is a discussion that's been going on for decades, essentially, because there is rigorous debate that continues within the scientific literature around representation and equity. I think from the AFEM perspective, we're interested in being participants and contributing to that discourse, but we're now looking towards solutions that break the cycle. And so we are, while still interested in participating in the discussion, we are even more interested in identifying solutions that interrupt the perpetual cycle that has existed for decades and continues to fuel the theoretical and the academic discourse around why inequities and structural barriers exist. And so from an AFEM and an AfJEM perspective, we're really looking for practical solutions. And AfJEM now, and has since 2011, since it was founded, served as a way for us to be able to think about solutions from the publication perspective. There are a number of different inequities that exist within the research cycle, not all of which can be addressed at the end stage of dissemination, which is essentially what the journal represents. But insofar as the journal is able to address that, we are supporting publications that are authored and co-authored by those who are living and working within Africa. And as part of that commitment, the journal aims for at least 25% of the journal's published authorship to be African citizens or permanent residents. And that has been core to the work that we do within AFEM, and it's been an unwavering philosophy that we've maintained since 2011. Not always easy to do, but it's something that we feel strongly about, and so it's something that we prioritize.
Well said. That's all for now, but I'm sure we'll be hearing from you again. And thanks again for joining.
Yeah, no, of course. Thanks for the invitation. It's lovely to speak to you.
It's all for this episode. We really hope you enjoyed the broad coverage of the African Journal of Emergency Medicine, which is truly a wonderful publication, and as you've heard, has so much impact around the continent, impact which is bound to grow exponentially over the years. And as I said at the beginning, each of my guests could have had their own episode, but we hope you enjoyed the brief interviews offering different perspectives across their different roles and backgrounds. We hope that this has inspired you to perhaps consider taking that jump and dipping your toes into a research environment. And that's about it. Be sure to review and subscribe on all of your main platforms, and send this to a friend or a colleague who might be interested. If you want to get in touch, find me on LinkedIn or email me at dan@badem.co.za. Please also follow us on Instagram and Facebook at Brave African Discussions, and X or Blue Sky as badEM. Thanks for listening. See you next month. Bye bye.